This is Dr. Howard Strassler presenting Restorative 528 lecture, OP11B, Update and Vital Bleaching, 1 hour in-office bleaching and bleaching relapse. When we talk about in-office 1 hour whitening, bleaching, we're really talking about patients who want instant gratification. They don't want to go through what's required to do at-home bleaching, wearing a tray for several hours a day over several weeks, but rather they want to have whitening that could be done in a single office visit. Let's look at what 1 hour whitening is to not only our patients but to us as practitioners. First of all, when we look at 1 hour whitening, we're using a very high percentage hydrogen peroxide, generally in the 25 to 35% range. While a rubber dam isn't necessary, manufacturers do provide the clinician with a light-cured flowable resin for gingival isolation. Generally, multiple visits are best. At least 2 visits, as many as 5 visits. Tooth sensitivity can occur depending upon the technique and the bleaching gel you're using, and some systems require light activation, light enhancement. There's some considerable controversy about whether light activation is necessary. And then there's extended chair side. Even though it's called 1 hour whitening, besides the prep time, the setup, and the bleaching procedure and breakdown time, generally an appointment will be an hour and 20 minutes. 1 hour whitening can be one of many different systems. For the light enhanced systems, you have the Zoom 2 from Discus Dental, the Sapphire system from Denmat, the LumaCool system, which is using LED technology. These require proprietary gels that are generally 25 to 35% hydrogen peroxide, but you can use anyone's whitening gel with anyone's light and achieve similar results. Now, when you compare light to no light activated in-office whitening, there are many different studies that really have compared these different systems. To the patients having in-office whitening, that a light is better, even though the research really doesn't prove that. And so the question becomes one of, in-office whitening, does it work? And from this research abstract presented in 2005 at the IADR meeting, that one of the things that they noticed is that there was a shade change seen immediately, but that there was a relapse of 50% of the shade change of the whitening within 1 week. Patients had moderate to severe tooth sensitivity, requiring ibuprofen-like drugs. In fact, in the red box, 91% of the subject experienced tooth sensitivity, the majority of which was moderate or severe. This study and several others have really demonstrated that when doing in-office whitening, it doesn't reduce the significant sensitivity that patients may experience. It may actually exacerbate it. One of the things that we know is that having the patient who's not aspirin sensitive take ibuprofen before the visit, at least 30 minutes before the visit, will lessen the sensitivity that the patient experiences during the treatment visit. So, heat or light activation to vital tooth bleaching, is it necessary? Well, in several research studies, and this is from one in particular, light activation didn't seem to increase the efficacy of bleaching agents. Color stability and enamel dehydration, which are important parameters to evaluate efficacy, light activated are lighter immediately after, but are less stable than non-light activated bleaching systems. They tested Extra Boost, which is a non-light enhanced system, a 38% hydrogen peroxide, Easy White Ready, which is a 30% hydrogen peroxide, and Zoom 2, which is a 25% light activated hydrogen peroxide. And so with the light activated, light enhanced systems, the teeth are lighter immediately, but that the relapse after 1 week is much higher. During a comparison of 7 different systems by clinical research associates, they tested 7 different systems. Some were with and some without light. All bleached very similar, comparing it to a standardized shade guide. There was no difference with light or without light, and relapse was generally seen within 1 year after bleaching with both light enhanced and non-light systems. About 41% of the patients had bleaching relapse, which means that the original whitening shade during the treatment visit and 1 week later, that the teeth had gotten, we use the word darker, they had changed to darker shades within 1 year. But keep in mind, even with the bleaching relapse, all the teeth at 1 year were lighter than before bleaching was started. In fact, patients don't notice bleaching relapse because they have nothing to compare it to. They just know that they're happy with the appearance of their teeth. How many visits are required for in-office whitening? Well, you often need more than 1 visit in order to reach a patient's level of satisfaction. And one of the things I'd like you to do is I want you to watch through MediaSite the Boost Technique video on 1-hour tooth whitening that'll take you step by step through the whitening technique. Let's look at some clinical cases. Cases that were treated using high concentration hydrogen peroxide, using in some cases light enhanced systems, in some cases no light enhancement. Keep in mind, had we done these cases without light enhancement, we probably would have gotten a similar result. So here we're looking at a light enhanced system with the Sapphire in-office system, a 35% hydrogen peroxide, doing both maxillary and mandibular teeth, and you can notice a significant change in the tooth appearance. For this system, and this is the system we use within the dental school, using a 38% hydrogen peroxide system, you can see that using the system, both maxillary and mandibular, and here we're looking at the teeth 1 week post-bleaching, you can see that there's a considerable difference that met the patient's satisfaction. Here we're using a 25% hydrogen peroxide system and then 1 week of tray bleaching between 2 in-office visits. In the other cases you saw, we did at least 2 in-office visits with the light enhancement, or at least 2 visits without light enhancement. In this case, and we have a Zoom 2 light at the dental school that we can use. In fact, we can use it with the Boost Extra system. And you can see that for this patient, it met their satisfaction. If the patient, though, wanted the diastemas closed, wanted the central incisors lengthened, it would require either an orthodontic or a restorative intervention. So it's critical that you do a comprehensive aesthetic evaluation to see whether the patient's satisfaction with the appearance of their smile can be enhanced not just through whitening but with reshaping the teeth with restorative materials. Here we're looking at another case where we're using Zoom 2, a light enhanced in-office 25% over 2 visits. Once again, notice the change that we're able to acquire both for the maxillary and mandibular arches. Now what's really critical is many times when we're changing the appearance of teeth, patients with existing restorations will need to have treatment plan the replacement of those restorations. In the upper right-hand picture, you can see that this patient has had bleaching, and before the treatment of bleaching was performed, they were informed that the Class 3 composite resin restorations and class 4 restoration that they had would need replacement. That we know that when doing bleaching, that the enamel becomes oxygen rich, and this decreases our adhesive bonding values. The recommendation, based upon research trials looking at adhesion and adhesive setting, basically tells us that we need to wait at least 1 week post-bleaching before placing any restorations. As part of your treatment plan, it's really critical that you discuss all composite resin restoration replacements that may be necessary before initiating tooth whitening, and the fees that are involved when doing these comprehensive treatment plans. So we know that if you're doing any adhesive composite restoration, the oxygen-rich enamel has decreased bonding values, and it takes at least a week for the enamel to have equilibrium for bonding. Don't choose a composite shade immediately after enamel dehydration. Wait at least a week post-bleaching before checking and selecting composite shades and before doing any adhesive restorative dentistry. What about bleaching relapse? Everyone would like the color to be just perfect after you finish your in-office procedure, even after you finish your tray bleaching at-home procedures. One of the things that we note is that when bleaching teeth, whether with a tray or with an in-office procedure, the enamel dehydrates. You'll notice this when you place a dental dam. Placing a dental dam dehydrates the enamel, giving the enamel a much lighter color. And so you wait, you don't pick composite resin shades after the dam is in place, but before you place the dam. For a patient, immediately after they complete bleaching, the patient needs to understand that there may be some slight relapse, that the color will equilibrate to a shade that's more tooth-like in color, and be slightly darker after the completion of bleaching. Patients generally don't notice those changes because the teeth will still be lighter than when the bleaching started. So we look at what clinical reports have said. Well, clinical trials report that 26% of patients had bleaching relapse after just 18 months. In all these studies, though, the teeth were still lighter in color than when they had started bleaching. Additional studies showed that 3 years after treatment, only 62% of patients still had a clinically acceptable color change. That's clinically acceptable to the patient. Patients are doing touch-up bleaching or going in and re-bleaching their teeth, some on a yearly basis, and there are no adverse consequences to doing that. In fact, in one study, 45% of the patients had their teeth re-whitened 7 years after the original bleaching to bring it back to the color status that they had after the bleaching was completed. So let's take a look. What patient recommendations can we make to avoid bleaching relapse? In fact, we can use over-the-counter products to help reduce bleaching relapse. We can recommend for the patient who has good arch alignment of teeth the use of white strips, either Crest white strips, Rembrandt white strips, house brand white strips, which are hydrogen peroxide strips, generally 6 to 10% hydrogen peroxide. We can use what's called Aquafresh trays. If you look in the upper corner, we have some preloaded trays with hydrogen peroxide that the patients can use. We can recommend to the patient the use of a carbamide peroxide containing dentifrice for use once a day, and the use of a low abrasive whitening toothpaste. These are all ways to avoid bleaching relapse. For patients who are doing at-home bleaching with trays, you want them to maintain the trays, and they can come back for refills of the original bleaching gel on a yearly basis. And this also can help us avoid bleaching relapse, minimize bleaching relapse. You've been watching an update on vital bleaching, 1 hour in-office bleaching, and the consequences of bleaching relapse. To go through and view the entire technique of in-office 1 hour bleaching, it's recommended you go to Media Site and REST528A Operative Dentistry and watch the video on Boost Extra 1 hour bleaching.